CS Mutahi Kagwe is at this hour waiting to receive a consignment of 400,000 vaccines from the UK under the COVAX platform at the Jomo Kenyatta International Airport. Kagwe is accompanied by the UK High Commissioner and other partners, among them UNICEF and the World Health Organization. Our very own David Mudoka is at the region's largest airport and joins us on the broadcast now. David, there is hope in the horizon tonight.
Indeed, Abubakar Abdullahi, you put it perfectly. There is hope in the horizon. But of course, I'll be getting into the details of that. And as they say, a bird in the hand is worth two in the bush. What do I mean by this? Of course, there is a bird in the hand, or let's say in the cusp of being in our hands, and that is a consignment of more than 400,000 doses of the AstraZeneca vaccine, which come from the United Kingdom through the COVAX facility, Abubakar Abdullahi. And of course, that plane, which has that consignment, will be touching down on Kenyan soil at around 21:50 hours East Africa time, loosely translated to 9:50 p.m. And that is roughly 30 to 40 minutes from now. And as you mentioned, yes, officials from the Ministry of Health, senior officials, we anticipate that CS Mutahi Kagwe will be leading those officials, as well as other officials from the government, to receive that particular consignment. And he will be accompanied by, as you mentioned, Abubakar, the British High Commissioner, Jane Marriott, and other officials from the World Health Organization, as well as UNICEF. Indeed, Abubakar, yes, you said there is hope in the horizon. This is the fastest signal to that. Remember, as a country, we have so far received just 2.3 million vaccines. And look at our population that goes up to 50 million Kenyans. So that is more or less like a drop in the ocean, especially in the fight against COVID-19. But this particular consignment now comes at a time when we have procured and received 2.3 million doses, administered 2.1 million of those. And in that time, 1.3 million Kenyans have received their first and initial dose, and just more than 700,000 Kenyans have received their second dose. That means they are fully armored in the war against COVID-19. But of course, that number is not as high as we want to achieve. Remember, by December next year, the government plans to vaccinate its full adult population. That is about 26 million Kenyans. And so, yes, we are making steps to that, but of course, there is hope in the horizon, as you put it. This particular consignment, Abubakar, comes in the backdrop of another consignment that came from the UK at the end of the last month. That was around 31st July. Of about 410,000 doses that came and of course received by officials from the Ministry of Health, among them CS Masi Mwangangi and CS Foreign Affairs Ababu Namwamba, and of course other government officials who received that particular consignment. And it comes at a time, of course, as you said, we expect other consignments to come in the near future. And by near future, it's near as Monday next week, where we expect 1.8 million doses consignment of the Moderna vaccine to be touching down here in the country. And at the same time, we expect another consignment of the Johnson & Johnson vaccine, of course, the much-hyped J&J vaccine. And sometimes in September, we expect another consignment of the Pfizer vaccine of about 1.8 million doses. And of course, that crucial step and a crucial move in the fight against COVID-19 in the country, Abubakar.
Pretext. Well, David, this latest donation by the UK is coming on the COVAX mechanism, which is the COVID-19 vaccine global access. You broke down the numbers in as far as what Kenya will receive, and to be specific, you make mention of Monday, which is, I believe, the 23rd of August next week. But we have equally seen more uptake locally, haven't we, David? And you have reported on this in this bit of Kenyans now wanting to be vaccinated.
Well, Abubakar, I didn't quite get your question clearly, but you must be asking about why is the uptake still not as high as we want it to be. One of the factors being, of course, the whole process has been plagued by vaccine shortage, Abubakar. Remember, just as soon as yesterday, we saw residents at Kirinyaga demand for vaccines actually going to various facilities, and due to the shortage and the shortage of other equipment used in the administration of those vaccines, such as syringes, they decided to take to the streets and demonstrate and call for the government to step up efforts to vaccinate its citizenry. So one of the biggest impediment, Abubakar, has been the vaccine shortage, but of course, headed into the next few months, we expect the whole narrative to change, because as I put it, the government indeed plans to vaccinate around 150,000 people in a single day and achieve around a population of 15 million people who've taken their jabs and a shot in the arm by Christmas this year. So with more vaccines coming in, plugging that hole, bridging that gap, of course we expect the numbers to rise in the near future. Abubakar Abdullahi.
Thank you. That is our reporter David Mudoka, who is live from the Jomo Kenyatta International Airport, where Kenya is tonight set